Hello everyone, this is Dr. Amit Maheshwari. As first MBBS university exam is approaching, I thought I should make video series on repeatedly asked Viva questions in biochemistry. This video can be useful for the rapid revision as well. So today's video we are going to discuss the repeatedly asked Viva questions from the topic diabetes mellitus. So the first question is, what is diabetes mellitus? So the answer is diabetic mellitus is a chronic metabolic disorder characterized by hyperglycemia which occurs due to the absolute or relative insulin deficiency. Then second question can be asked, what are the types of diabetes mellitus? So majorly there are two types of diabetes mellitus. First one is a type 1 diabetes mellitus, which is also known as a insulin dependent diabetes mellitus, and second one is a type 2 diabetes mellitus, which is also known as a non-insulin dependent diabetes mellitus. Then third question can be asked, what are the differences between type 1 and type 2 diabetes mellitus? So the major difference between type 1 and type 2 diabetes mellitus is frequency of type 1 diabetes mellitus is around 5 to 10%, while frequency of type 2 diabetes mellitus is around 90%. The age group where type 1 diabetes mellitus is more common is less than 20 years of age, while the age group where type 2 diabetes mellitus is more common is greater than 45 years of age. The etiology for the type 1 diabetes mellitus is absolute insulin deficiency. So the circulating insulin is either low or absent. While the etiology for the type 2 diabetes mellitus is the relative insulin deficiency. So the circulating insulin is either normal or it is increased, which majorly occur due to the insulin resistance. Then ketosis is more common in type 1 diabetes mellitus, while it is not so common in type 2 diabetes mellitus. The weight of the type 1 diabetes mellitus patients are generally lean and thin, while the type 2 diabetes mellitus patients are generally obese. Then, what are the tests done for the diagnosis of diabetes mellitus? So, majorly two tests are done for the diagnosis of diabetes mellitus. First one is a HbA1c, which is also known as the glycated hemoglobin, and the second one is a OGTT, that is oral glucose tolerance test. Now another question from this can be asked, that's what is HbA1c? So the HbA1c is the glycated hemoglobin. So when there is a hyperglycemia, the glucose attached to all the proteins of the body. So over here glucose is attached to the hemoglobin and it is a non-enzymatic process. Fine, so that's how this glycated hemoglobin is formed and it gives average blood glucose value for around 10 to 12 weeks. Fine, so that is the advantage of HbA1c, and if the HbA1c value is greater than 6.5%, then it is suggestive of diabetes mellitus. If it is less than 5.5%, then it is normal. Then another question can be asked, what are the criteria for the diagnosing diabetes mellitus from the OGTT? It is a WHO criteria. So if the fasting blood glucose value is greater than 126 milligram per deciliter and the 2-hour post glucose load value is greater than 200 milligram per deciliter, that means it is suggestive of diabetes mellitus. Then another question can be asked, what are the clinical presentation of diabetes mellitus? So in the diabetes mellitus there is a classical triad, that is polyuria, polyphagia and polydipsia. Polyuria is the excessive urination, polyphagia is the excessive eating and polydipsia is the excessive thirst. Apart from this, there can be also glucose excretion in the urine. If the plasma glucose level is greater than 180 milligram per deciliter, that is a renal threshold for the glucose. Apart from that, there can be recurrent infections can also be seen. So this is the clinical presentation of diabetes mellitus. Then apart from that, they can be asked what are the other investigation that we can do for the monitoring of the diabetes mellitus. So we can do HbA1c, which is one of the best tests for the monitoring of diabetes mellitus. Then we can do FBS, that is fasting blood glucose level, PPBS and RBS. PPBS is the postprandial blood sugar and RBS is the random blood sugar. The normal value for the PPBS is 70 to 100 milligram per deciliter. For the RBS is 80 to 140 milligram per deciliter and for the PPBS it is up to 140 milligram per deciliter. Then what are the complications occurring in a diabetes mellitus? So it is divided into two categories, acute complication and chronic complication. In the acute complication, first one is a diabetic ketoacidosis, which is characterized by the ketonemia, ketonuria and acetone smell in breath. And the chronic complication, there is a vascular disease like atherosclerosis, then diabetic retinopathy, diabetic nephropathy and cataract. And another question can be asked is, what is fructosamine or glycated albumin. So as I discussed, when there is hyperglycemia, glucose is attached to all the proteins which is present in the body. So over here, glucose is attached to the albumin, and as the half-life of albumin is around 20 days, so we can have idea about the glucose control for say around 20 days. And the glycated albumin is very useful in the condition where HbA1c is not useful, like hemoglobinopathies, as well as in the gestational diabetes mellitus. Fine, so these are the questions can be asked from the diabetes mellitus. Thank you. Please like, share and subscribe Biochemistry Basics by Dr. Amit, and don't forget to press the bell icon so you can get all the notifications from it. Thank you.